Dear friends, dear colleagues, hello. It is Wednesday, it is 2 o'clock, and it is time for EASPD webinar. Today we have very interesting topic. It is EU funding opportunities for non-EU members. It is a topic that is very actual in the region of Central and East Europe. But the financing of the services, it is a very popular topic for all of us as a service providers. I will start this webinar with technical information, sharing with you technical information that this webinar is recorded and it will be published. Unfortunately, because of the number of the participants, all of you are muted except the speakers. But you can use the Q&A box, so you can ask questions addressed to the speakers, and you will receive answers from all of them. There is also a real-time captioning, so you can activate subtitle. It is in the middle bar on the right. So there is a button, closed caption. So you just need to click on it and you will see the subtitle. All the presentations, as it is usual, all the presentations from today's webinar will be shared with all of you who are registered for today's seminar. On the very beginning, I believe that all of you knows, but for those who are for the first time participants on the webinar of EASPD, briefly about us. We are non-profit based in Brussels, established in 1996, next year 25th anniversary. Our objective is equal opportunities for people with disability through the effective and high quality service. System of service in Europe, which services are affordable, available, adaptable, accessible. EASPD today represent over 17,000 services providers in 33 European countries, covering all types of disability. Today's topic is because of the impact of COVID-19 on service providers. So during the pandemic, especially non-EU countries are faced with difficulties, financial difficulties. So it is very important EU funds to be accessible for the service providers. EASPD work for a wider social Europe for all, leaving no one behind, that providers guarantee universal access to high quality support service for those in need. This webinar aims to provide an overview of the challenges faced by the service providers for persons with disability in the Western Balkans and Eastern Partnership countries. This is an opportunity to share important concerns, information, and to exchange our practices. The current COVID-19 crisis showed that this virus has no borders. We are all faced with the same problems. In this context, the EU has launched Team Europe Global EU Response to COVID-19, supporting partners, countries, and fragile population. Concretely speaking, the European Neighbourhood Policy has built up supporting funding programs for the Western Balkans and Eastern Partnership countries. Today, we have very interesting agenda. We have three very interesting presentations. One of presentation, the first one is coming from Albania. The second one is coming from Armenia. And the third one is coming from the head of unit of the DGR NEAR for Armenia, Azerbaijan, Belarus, and Eastern Partnership. So I wish you a pleasant presentation, and please ask a question in the Q&A box. As it is presented on the agenda, I'm asking the representative from the Health and Life Association from Albania, Eglantina, to take a floor.
My name is Eglantina, and I'm representing today Health and Life Association in this webinar. I hope everyone is good and safe on this pandemic situation. I'd like to thank also EASPD for this opportunity that to bring to you for all the participants today the case of Albania, how we as service providers have faced this difficult situation in our country. Health and Life Association is an organization that provides services for people with disabilities since 1998. Services for the whole cycle of life of a person with disability. During the COVID outbreak, like all the other institutions, even the service for people with disability was in March 10th were closed. And we as service providers faced dramatic change on our services, because all the activities was cancelled and postponed from the donors, because in Albania, the services that are provided by organizations like ours are not supported financially by the government. And as we are donor-based, our services are donor-based, we faced a big challenge on providing all the administration and financial support for the staff and managing all our services. Also, what we have faced was that NGOs was left behind by the COVID financial support scam of the government, which put it in a great risk, the sustainability of our services. Most of the staff lost their jobs because the service providers wasn't able to provide their salaries. Also, we have faced a great challenge because from our government, no guidelines or protection protocols were provided to us how we have to provide care and support for people with disability during this period of time. Also, there was a big lack of accessible information in public institutions during COVID for people with disability, with intellectual disability, hearing, and visual impairment. We, for example, as a service provider, we have adjusted easy to read information, and we have delivered it to all our users. Also, the same did other organizations that provide services for hearing and visual impairment people. We are now in a state that daily centers that provide services for people with disability are not open. We have opened only centers that provide one-to-one therapy sessions, which is still is making difficult the situation of service providers that provide services in daily basis for people with disability. Also, there are other challenges that have faced by program-based or by people with disability themselves. In program-based, we needed, at the time of COVID, we needed to adjust all the staff to make adjustment of our programs that we provided support for people with disability now online, not face-to-face. Also, one of the challenges was lack of IT resources, tools, knowledges of the parents, how to implement the program at home. A dramatic change have happened to the routine of the children, causing behavior problems and display of new inappropriate behaviors, which the staff had and the parents had to deal also with this kind of challenges. Also, skepticism and prejudice of parents about the result of the online support. As well, psychological well-being of the parents, children, and the employees of service providers, which were providing this kind of support, most of the cases in voluntary basis, so without payments, without salary. And also, what we have faced was a regression of the children development during this period of time. How we managed to do all this. We adapted, as I said before, we adapted our work because our mission is to provide services for people with disability, even though our government doesn't support us with finances and are left us outside all this great support during this pandemic situation. We all started designing individual online programs based on people with disability needs. Also, we have provided easy to read information about people with disability. Psychological support was provided, and also tools, food, and other humanitarian aid was provided by different organizations during the pandemic situation. To parents who were provided support through counseling and overcoming the stress and anxiety. Also supervision and technical assistance, and proposed materials and tips for family environment relevant to family needs and opportunities. Also, as organizational based, we gathered as service providers and we sent letters to the authorities, Ministry of Health and Social Protection, Ministry of Finance and Prime Minister, to support service providers and people with disability during this pandemic situation. Nevertheless, their answers was negative, that they couldn't support us because we are service providers and our funds are supported by the donors, which is not true because, as I mentioned at the beginning, we faced also the cancellation of all activities by the donors in most of the cases, or a reduction of their finances. Also, what we did as service providers, we sent a letter to your delegation with also the support of EASPD. They endorsed this letter of request, requesting the attention of EU delegation here in Albania about the finances of their financial support in order that they should be available also to organizations and NGOs that provide services for people with disability. How we see the recovery after COVID. We as service providers, we are planning to advocacy and lobby with our government to put people with disability on the priorities and the agenda for after COVID recovering programs. Also, we want to encourage our local government to draft their social plans and to review the priorities of those drafted in the sight of COVID-19 consequences, by guaranteeing the social inclusions of persons with disabilities through accessible, inclusive, and specialized services, financed through the distribution of the social fund. Also, we want to draw the attention of our government to urgently develop a coherent legal framework and strategies with clear measures and protocol of work, because this was what we have lacked also during this pandemic situation, that will allow us as service provider to support people with disability and their families during the times of crisis. Also, we as NGO are planning to adjust some of our program and our strategies to provide to people with disability based on the consequences of COVID-19. There are surveys that are undertaken and conducted by international organizations which about the situation of people with disability, and we are taking in consideration this the finding of these surveys in order to provide the support, the right support for people with disability. A second lockdown that we hope, because in Albania we have an increased number of the cases that are the cases with COVID, and we hope that won't be a second lockdown, because if it will happen, everything it would be terminal for services for people with disability. What we are asking, as we today are talking about the EU and EU help, what we are asking as service providers in Albania from the EU, our services are currently not supported by state, as I mentioned at the beginning. Therefore, during this period, we have there are no other alternatives to support persons with disability and their families. And so it is essential to find a solution to prevent the negative consequences to NGOs, and that will not be easily reverted in case that it will happen. That's why we want to draw attention to the EU, so they can draw attention to our government to put in their agenda of COVID recovery, the support to service providers for people with disability. Without this, the continuity of our service will be put in risk. Also, EU financial help to be assessed by by NGOs in Albania, which provide direct social care and psychosocial services to people with disability. As well, to draw attention to international funding agencies acting in Albania to put in their funding programs the support of social care and psychosocial services to people with disability, which I want to stress that we lack at this moment, because funding agencies supporting service providers is a duty of the government, which is stated in the Convention for the Rights of People with Disability that our government has signed and ratified. As such, all the international donors, they provide programs, supporting programs, not for supporting direct services, but this is what we are asking now, because as our government doesn't support us, so we want to draw their attention that to direct their programs on direct support to social services for people with disability. So that's it. Thanks a lot for following us, and I'm giving the floor to Vasily.
Thank you, Aglantina, for your brief presentation. I am aware that you can speak a lot in details about the situation, but the situation is more or less similar. It is the same in the worldwide. So yes, it is very important to be accepted as equal partner by the government and to have equal access to the funds.
Yes.
The next presentation is coming from Armenia. Due to some changes, I think that Domenico will do the presentation today for us instead of Susanna Tedosian, President of the Bridge of Hope from Armenia. Unfortunately, she couldn't do that today. So, Domenico, please.
Hello, everyone. Yes, I will share the presentation from Susanna. Hope you can all see it. So here there is a general overview of what are the needs and challenges for a service provider during the corona crisis in Armenia. The main threat is that NGOs may get left behind in different ways. The first one is the so-called existential threat, meaning that it's needed to guarantee the financial support for the organization to maintain the organization as such working, and the funding for the operational work and the staff cost is one of the existential threat at the moment. The second one is the provision of support to make the right decision in order to maintain the good health of the NGO, to further its mission in the longer run, and also support the development of creative and innovative programs that are at the same time safe and effective. The third layer of threat, let's say, is the capacity building needs. In this case, service providers need to be, the services need competent staff that are able to use accessible communication and ICT, so that they are able also to produce accessible material. And also there is a funding needed to produce useful material and resources. Here there is an overview of what is next. So what is the plan for the recovering period after COVID crisis? The main element is that, of course, services need to deal with the consequences of this pandemic. On the short term, services need to collect people's insights and views on the effects of the coronavirus on their communities, to inform also future programs. On the medium term, there is a need to review and adapt the advocacy strategy of the organization, focusing on disability, inclusiveness, and also sustainable development advocacy. On the long term, there is a need to review the internal policy of the organization, taking the lessons from the corona crisis, and also to develop clear and effective strategy to deal with emergencies and possible future similar situations. Thank you all. I'll give back the floor to Vasilka.
Thank you, Domenico, for this presentation. Later on, I expect in the panel discussion, the representative from Armenia give some answers of the questions asked by the participants. So on the end I would like to give a floor to head of unit of DGR for Director General for Neighborhood and Enlargement Negotiations for Armenia, Azerbaijan, Belarus, and Eastern Partnership, Mr. Vasilis Maragos.
So thank you, Vasilka. Good afternoon to all of you. I'm particularly pleased to be with you today. I work on the Eastern Partnership. You described it well, but I'm going to speak also about the Western Balkans, and I will be happy as well later if there are any questions on all the issues that occupy you. I heard with a lot of interest the presentations which were made earlier from our friends in Albania and in Armenia, and as it was noticed already, we have similar problems that we face in all the countries actually, and we hope that we can provide an equally responsible response from our side. We are sharing in particular your concern about the significant impact the COVID pandemic has, mainly on the members of your association, social services providers, but more generally, as we have just heard from Armenia, the civil society and other vulnerable groups. Of course, people with disabilities are undoubtedly among those who are disproportionately affected. So we see the meeting today as also an opportunity to hear from you and to see how we can respond in the best possible way to this crisis. On the other side, I see that we have many members of your association from the EU member states. So we are also very keen to hear from you on how we can support the links between the member states, agencies and service providers, and also the service providers in our neighborhood. Investing in our neighborhood, it is also an investment in the resilience and in the well-being of the EU itself. So we should not see this as a competition, but rather as a basis for our joint resilience, but also for more solidarity and cooperation. Because during the time of crisis, in particular, we become stronger when we cooperate and we try to address the challenges together. When now it comes to the EU response to the crisis, I would like to give you the overall approach that we have taken. And of course, I know that this may include too much information, but I will be happy with my team. By the way, I'm here with Gabi Hagmüller, who is working with me on civil society issues, and also colleagues from the Western Balkans, in particular, who are ready to respond to specific questions. So Liselotte Isaksson, in particular, is here. So first of all, we have responded to the crisis from the very beginning. We have issued a communication on the 8th of April, and we have established the methodology on how we should work, in particular by joining the forces of the European Union institutions, the EU member states, but also the financial institutions. So this is what we call the Team Europe approach. So we are working together in order to maximize the impact of what we are doing. In particular, this applies to the emergency assistance which is being deployed on the ground, but also to the assistance to vulnerable groups, but also our joint work with the financial institutions. Now, when it comes to, you mentioned Armenia. Armenia is part of the Eastern Partnership. In our Eastern neighborhood, we have deployed by reorientation, by acceleration, and by facilitation of the use, we have deployed an amount of almost 1 billion euro in assistance in a number of areas. This covers short and medium-term support to the social and economic recovery of the region. Some of it goes to the government, some of it goes to the civil society, but also we have a lot going to small and medium-sized enterprises. Among these, we have an amount of around 80 million, which is being deployed for immediate needs. To give you an example, we have signed a contract with the World Health Organization, and now we are deploying much needed medical support to the whole region. The deliveries are about to come. When it comes to the Western Balkans, we have put together an unparalleled package of measures to support the region. Also, we have associated the region to some of the EU mechanisms together with the European Investment Bank. And the whole package that has been deployed for the Western Balkans is amounting to 3.3 billion. A clarification, this includes also the loans from the European Investment Bank. loans which are important and essential for the economic recovery of the region. But it covers also immediate health and humanitarian needs which are being deployed on the ground to address the concerns of the pandemic. I would like to underline here that we are also supporting vulnerable groups, in particular Roma, migrant communities, but also other vulnerable groups through the civil society. Just to give you a small example, I mentioned already that in the Eastern Partnership we are working with the WHO. We are also working to support the Western Balkans. In the area of health, the amounts that we have deployed are almost 40 million, 38 million euro. And here we are giving very concrete support. We are financing deliveries, we are financing respirators, ambulances are included in the Western Balkans, and of course a lot of millions of further equipment, personal protective equipment, equipment for the intensive care units, but also X-rays and tests. So we are providing many hundreds of thousands of test kits in both regions. To help mitigate also the economic and social impact, we are, as I mentioned, funding SME support, in particular by providing liquidity and facilitated loans. It is equally important that we find an equally, if you like, coherent response when it comes to the specificities of the vulnerable groups. So this is why, as I mentioned, we are focusing a lot on the civil society. So in the Eastern Partnership, we have foreseen 10 million to boost the grassroots civil society actors to support and protect the most vulnerable in society. All these projects are focusing on protection of vulnerable groups, but we also invest a lot in raising awareness about the epidemiological aspects of the pandemic, but also other issues which have to do with information, but also with countering disinformation, which is essential for to address the public health crisis. In the Eastern neighborhood, we are implementing this through framework partners. So we have a number of framework partner organizations which are providing this assistance, but these are the channels we are using. The final beneficiaries are organizations on the ground and grassroots organizations. And of course, we will be particularly happy to take into account all the needs that also service providers are raising with us. So we are going to some more details about this assistance. We are entrusting, as I mentioned, our partners to develop financial support, including core funding. So to allow those civil society organizations, as we have heard a moment ago, who are facing these challenges of survival, to allow them to continue operating, provide services, provide equipment to the most vulnerable groups, but also to those who are disproportionately affected by the pandemic. This is, I think, extremely important for you. So I will be very keen to give you further details if you wish, so that you can benefit directly from this support. Second, we are providing capacity building opportunities to help local CSOs adjust to the situation. And this means mainly advisory services, development of skills, in particular when it comes to distance use of various distance and digital tools, so that we can work and communicate remotely and engage and outreach to constituencies, train, for instance, elderly people to use such IT equipment. That would be, I think, extremely important, not only now in the short term to address the pandemic, but also for the long-term resilience. Some of you who come from the regions in the various countries, they know that people in particular outside the capitals are extremely vulnerable on this, and they need to link up, in particular now in the lockdown situations, in varying degrees, of course, in the various countries. And finally, last but not least, we are again focusing on awareness raising. It is essential that the people understand better what is happening, have access to accurate information about the pandemic, but they are also not liable to disinformation campaigns, and also they can understand themselves the situation, they can judge by themselves what is happening, so that they can react and take decisions about their own lives. So just to say that we are now finalizing the arrangements for these contracts to now start to be implementing. When it comes to the Western Balkans, we are, apart from supporting the health and social protection systems of the governments, there has been a special attention to ensure that we are focusing on the vulnerable groups, vulnerable persons, people with disabilities, elderly people, victims of domestic violence. I have to say that we are already funding a lot of projects in both regions, by the way, to support victims of domestic violence, which unfortunately has become a feature and a characteristic of the previous lockdown period. And we hope that with our support, we can help raise awareness, but also give the direct psychological support to those who have been suffering from this. Also in the Western Balkans, we have reoriented several ongoing projects to cater for more vulnerable groups. Here I would pay more attention to Roma families, in particular when it comes to issues related to food packages, hygiene, etc. But also in the Western Balkans, we have social protection programs which are provided through budget support to the governments, and they are linked, these budget support programs are linked with specific performance indicators. So for instance, in Albania, we have a 50 million program for social protection, which is now being enhanced with an additional 20 million in order precisely to help on this additional social support, which is being provided by the government. I understand I have only 1 minute, Vasilka, sorry for that. I'm going to be to go faster on this. We are implementing these programs through civil society organizations, but also with some international partners. So just to complete my presentation, the EU sees the civil society as a key partner in cooperating to address the COVID-19 crisis. We are spending more than 5% of the total budget that we are implementing in the regions for civil society. And we are also ready now to see how we can support the various organizations to do more, how we can support through calls for proposals in the delegation. So I would like to ask all your members to look into the delegation's websites when these are published. And of course, we are ready to discuss with you in terms of a dialogue, in terms of engagement, to see how we can ensure that this period does not create problems to the civic space, which is one of our main concerns. In some countries it is particularly acute, in others it is mostly the cooperation that you expect from the governments, on which we are also very, very much supportive. And also we are ready to discuss with you. I have heard from the first speaker from Eglandina some requests concerning the EU, how the EU should be interacting in the policy dialogue. And of course, we are ready to discuss all this with you and to see how we can, again, together, be more efficient in order to strengthen the resilience of the local communities, including, in your case, the people of disabilities, their families, the parents, so that we can address this together. Happy to be with you today, happy to participate in this discussion, to take note, and of course, on behalf of myself and of my colleagues, we are absolutely ready to reply to questions, but also to further engage with you on how we can enhance our cooperation in the future. Thank you very much, and looking forward to any questions there may be later. Thank you.
Thank you very much for your presentation, but also thank you very much for encouraging message that you have sent today and you share with us. Now it is a time to give a floor to Carmen, the development manager from EASPD. Carmen?
Yes, thank you very much, Vasilka. Hello, everyone. Good afternoon. Now it's time for a live discussion, also taking the questions from participants. So we have more or less 15 minutes to cover maybe key topics from the presentations you have heard. I also took a good note from the questions both in the chat and the Q&A. So I would like to start the discussion, of course, taking the opportunity that the European Commission is here with us today. So Vasilis, I also take from the chat maybe some practical questions. The opportunities you have presented, it's all the opportunities are going through national governments, or are there some direct opportunities from the European Commission, so to say, in Brussels, so centrally managed in Brussels? How that works in practice?
Clearly, not all the opportunities go through the government. As you know, those of you who interact with the European Union, we are managing directly many projects in Brussels, but also mainly through the delegations. So this is the way we are doing it, through calls for proposals, but we also have in the Eastern neighborhood another instrument which we call Rapid Response Mechanism. I'm sure that this instrument will be soon available also in other regions, including the Western Balkans. But there as well, we are ready to receive concrete proposals and to fund quick impact projects of up to 60,000 euro. So I would like really to ask any person, any association which is interested in cooperation, first of all, to look on the website of the delegation, second, to look on the website of DG NEAR in Brussels, but also if you have some concrete ideas, please contact either us directly or the delegations to discuss, in particular when it comes to some quick impact projects.
Mm-hmm. Thank you very much. That was quite clear. Also, we will be happy as EASPD also to provide information to our members and partners. I would like to move now to the representatives of the sector. Vasilka and Eglantina. Vasilis was also asking at the beginning, how can the EU support the organizations? So we have heard some challenges. So can you maybe, Vasilka, explain in a short introduction, what kind of support are you expecting from the EU? For instance, to support the way services are changing. Let's say online support. So what kind of support are you expecting from the EU in your country and in the region?
Up to now, we are really supported by the EU, especially and very important support was the process of deinstitutionalization. The whole process is supported by the EU. So it was created the strategy, and the process has started with the creation of community-based services, different types of services. And now it is ongoing a grant scheme for DI, but it is under IPA funds. But today we have received information about the possibility of the temporary suspension of the ongoing IPA grant scheme for DI in our country because of the whole situation with COVID-19. So for me, it is, I'm really concerned about this. Yes, they should do this temporary suspension, but I'm concerned that the reform process will be, the delay of the process will be postponed, and I don't want to see that DI is not on the priority agenda of our country anymore. So that is my main concern, but I really hope deeply inside me that as soon as the situation is stabilized in my country, the reform process will continue. So that is my concern. On the other hand, recently the government has published the call for support of the NGO, including service providers, as a financial support for the COVID response. And that is a positive information that I can share with you. So the service providers, we as a recognized service provider, we are functioning online support of the clients, of our users and their families, but we are looking forward to start again to work face-to-face, in person with our clients. So that is from my country.
Thank you very much, Vasilka. Indeed, now going back a little bit to the Commission, we have said so also on the chat. There is a main concern in several countries. Albania was one of the countries that was giving that example, with the issue of which kind of organizations can have access to the funds. So for instance, the definition of the SMEs. This is something we have also seen maybe for another EU funding opportunities, maybe related to the structural funds. So maybe what is the state of play? What is your opinion about what kind of organization can get access to those funds? And what about the definition of the SMEs? So if maybe Vasilka, or I don't know if Liselot can elaborate a bit on this.
Let me just say one word on this. We are aware of the problems that in some countries may come up when it comes to access to funds for SMEs. We are looking into this. Of course, we follow the definition which is accepted in every country, in separate countries, which is accepted by those countries. So this is something which we cannot change right now. But on the other side, when it comes to support through the EU funds, I think there we of course are open to consider what we are doing directly ourselves. We are open to consider. I mean, I'm aware of some difficulties, for instance, that some service providers have in order to be recognized as SMEs. I think that the whole legislation which is linked probably to social enterprises needs to be adjusted so that we can have at least the support which comes directly for the social enterprises directly from the European Union can be as open and as broad as possible. But if there are some specific issues which concern the countries we are talking about, we are particularly pleased to follow this up either with the government or with the delegations and the country desks, depending on who is responsible. I have seen in the chat, because I don't know how much time still we have, I have seen in the chat many concerns about the direct support from the European Union to the associations of disabled people. I would be particularly pleased if we can receive some of these questions in writing, probably from your association, and then we can circulate and try to give you some more concrete response. Because I think we have an obligation to find a way to support you in the very good work that you are doing. So, of course, there are the possibilities of call for proposals. This is competitive. There are no endless funds for everybody. That's clear. So we cannot cover everything, but we are ready to consider how we can support the associations. Both I saw in a question about Ukraine, for instance, but also in other countries. So we are ready to see how we can more concretely engage, and I think also in the Western Balkans, but Lotta can give more information about that. There will be a call for proposals just for people with disabilities. So I think that we are there on track to deliver on what are your expectations. But we are going to consider this also in the countries of the Eastern neighborhood, and we will be happy to share the information with the association so that you can share it with the members.
Thank you very much, Vasilis. And indeed, we take the very seriously the invitation, as my Secretary General will say, I hope, Luke, that you will have a letter tomorrow in your desk. So as I mentioned you, Luke, I would like also maybe to address to you that you have an overview of what is happening in many different European countries, and also something Vasilis mentioned at the beginning. How can improve the links between EU members and no EU members, so that at the end the EU funding opportunities available benefit the most vulnerable in societies, and also benefit also the changes that service delivering is experiencing now with this crisis. So Luke, can you maybe say a brief last introduction before I give the floor for conclusions? Hi, Luke. Okay, I'm afraid maybe there is some issues with sound or image. Well, in any case, as I was saying, I think this webinar was a very good opportunity to gather all the concerns of the sector, but also to work closely together. So now, Akos, over to you for conclusions. I would like just briefly to introduce Akos from Hand in Hand in Hungary, has been chairing EASPD Committee on Enlargement. I think you also share this idea of how the links between a member state and non-member state we can work together. So now over to you, Akos.
Thank you very much. First of all, let me share my personal impression about this occasion, about this 1 hour. It's amazing that more than 60 participants from this region, mostly from those countries which are not member of the European Union yet, and it's a wonderful opportunity to link each other and to meet each other. Why I'm saying that? Because I remember that 15 years ago, when we ran this special standing committee on enlargement, it was very, very difficult to find each other, to find partners in certain countries. And yes, we had a lot of problems with the COVID-19, but one thing is sure, that this online culture and online issues opened new platforms and new challenges for communication, which could be complementary, not replacing the real communication. And in that way, we are ready and we are able to connect each other and link each other. I think it's a great opportunity. It was really, really useful and interesting hearing the presentation from the given countries, and also the the response of the EU. And I just would like to pick up some topic, if I can move, just a moment, please. Yes. So civil organization, civil society organization are still playing a crucial role in helping and solving the crisis and solving the problems. And it's true in the Western, well-developed countries, and also in those who are still on the ascension in the neighboring countries. And I think it was demonstrated during the coronavirus period too, because we are near to the clients, we are near to the reality, and we know what's happening and what is the need, and we have idea what could be the solution and what kind of measures need for the solution. But it's always a risk that we are flexible, we are near, we are at risk due to insufficient support from the public authorities and resources. So that's why we have to fight, we have to lobbying a lot. And of course that we are lobbying for the EU, for the national governments, but we also have to do our side in order to finding new opportunities of solving the solution, like the crowding funding and convincing the people themselves to help us, because we have the right. But the EU must play an active role in supporting the development of the civil society organization, the NGOs, and of course the CEOs still have to play a crucial role in solving the social issues and taking part in the social welfare system. What to do in the future? Of course, the European Union was set up for many reasons, but one of those that we can do, and we can cooperate, and we can solve problems together. That's why the EU should provide political and financial support ongoing. That's crucial. That's true. We are paying a lot of taxes, and we want to give back too. Of course, the EU should promote the dialogue between the stakeholders, the public authorities and the NGOs, the CSOs. And the EU financial support to neighboring countries must also specifically target civil society organizations and NGOs. And we strongly recommend that the EU should revise the direct support for the NGOs in the given countries, because national governments, not only in Hungary, as heard in other countries, Hungary is already in the member of the EU, and still the authorities are hardly willing to share the EU funds for the NGOs, because we are not a real partner. What could be we have heard that what is the situation in those countries where we are out of the EU yet. So these measures must ensure that NGOs and CEOs are not excluded from the measures implemented by the national government. As already was told that measures in support for SMEs in the country must also be of support to NGOs and CSOs. So that's mainly the main point in my meaning and in my interpretation. And I'm very proud that, again, I would like to emphasize myself that repeat myself, sorry, that so many participants from different countries are together. And last but not least, I would like to raise your attention to save the date, because of course this hopefully the pandemic is going to be over, but the webinar maybe not. Maybe it's an ongoing process and we cannot stop. So the next meeting point on the online platform is 24th of June, Wednesday. You could read the topic face-to-face and moving to online mode during COVID-19. The second one is the Social Summit webinar on Thursday, 25th of June. So for those who joined the first time, I personally encourage you to be with us and stay with us and join next time again, and keep in touch and taking active role in the EASPD family. Thank you.